His comments on our show just 24 hours ago made national headlines, and the head of the Australian Medical Association warning Victoria is a heartbeat away from calamity.
Now, since then, 403 new cases emerged. 5 more families are grieving, bringing the state's death toll to 49. Dr. Tony Bartoni joins us again from outside St Basil Aged Care Home in Melbourne's north. Doctor, thanks so much for joining us. Now, your worst fears, it seems they're becoming a reality. It's grim.
Look, it is, as I said yesterday, it is a really deep and deeply concerning situation. We've tried to really bring the spotlight on it. We needed urgent work and urgent attention to be focused on this. We've already started to see the reserve of hospital and healthcare staff coming in overnight in terms of the announcements, but we really need a solution to try and, as I said, be that circuit breaker to the situation here. We need to look at what we can do about cohorting residents who are testing positive in the facilities into one part of the wing. We need to actually look at, can we take the index case, the first case that tests positive, out of the facility in terms of minimising any future spread in that facility. We need to look at things like what we call subacute step-up solutions, where a facility between the aged care facility and the hospital, where like is kept with like, and of course infection control is actually absolutely primacy, and you've got dedicated professionals looking after those residents. There are many things that we need to bring, but what we do need is we need more trained staff with more PPE being utilised where provided and mandated, and of course we need attention to those infection control procedures and following the guidelines, and we need the people overseeing that, the Aged Care Quality Safety Commissioner, making sure that those guidelines are being followed.
So Doctor, it was a very, very big deal for you to come out so strongly on our program yesterday. And the reaction was huge across all of our viewers, and they appreciated the candour and they appreciated your insight. What changed after you made those comments? Did Victoria become a safer place?
Look, whether it was my comments or whether it was all the other stakeholders who are also quite seriously concerned about the situation, there is now an even deeper awareness of the immense complexity and the immense issues that are confronting us in aged care. We need a solution. This was a sector that was already doing it extremely tough before COVID-19. We have a Royal Commission that was due to hand down its findings in November, but it's being pushed back because of COVID to next year. This is a sector under the pump, and then COVID-19 came along. We needed extra resources, and that's why I made the plea yesterday. That's why I went the way I did. I wanted to ensure that everyone was aware, and we've started to see resources, and we've started to see decisions being made. No one's walking away from the complexity, but it needs funding, it needs resourcing, it needs staff, and it needs it now.
Yeah, and it needs to be called out too. Now, complacency is one thing. People ignoring the rules and blatantly doing the wrong thing is another. I want to show you this video and get your reaction to it.
I don't need to answer your questions. No. Have I committed a crime? Pardon? Have I committed a crime? Have I committed a crime? Thank you.
Now, her reaction at the end of that, she cheers as though, woohoo, I've bucked the system. It's appalling. And the fact that she was waved through, what's your reaction to people thinking that that's the way to behave?
Look, I can't understand what possesses some people to do what they do. Clearly, that bizarre is one way of describing it. Absolutely reckless is another word I would use. I would like to take that lady through the intensive care wards and show her the ultimate outcome of her ridiculously stupid behaviour. And really, just everybody needs to hear the message and hear the guidelines. They're there for a reason. They're not there to make our lives miserable. They're there to protect lives. They're there to make the community safer. And she should get a real... Just look at what's going on.
Reality check.
And you know what? She liked it so much herself, she posted it. I mean, that's so disrespectful to our frontline workers. Tony, before we go, you've been a very wise and calming voice to us and our viewers throughout this whole crisis. But Boy, do we need something positive right now. Can we beat it?
Look, Carl, we certainly can, and it's about following the messages, as we said all along, and following the guidelines. If we do what we're being asked to do, if we decrease our movement, decrease our mixing, getting ourselves tested if we've got even the slightest of symptoms, and isolating them while we're waiting for those tests, we can really get on top of this. It's going to be hard, it's going to be tough. Melburnians have done it before and we'll do it again, and I'm sure we'll come through it. But we just need everyone doing their part, but we also need the plan to come together, and everyone in that part of that plan doing their best. And I know, because Melburnians are a community, we all want to get through, we want to get out the other side, and we'll get through this, I'm sure.
Yeah, really important message to be delivered. Good on you, Doc. Thanks so much for joining us. Dr. Tony Bartoni there.
Fantastic fella.